I'm Hiva Fassihi, consultant dermatologist at Welbeck, and I'm here to go through some of the more common questions that patients ask me about psoriasis. What is psoriasis? Psoriasis is a common inflammatory condition of the skin where there's a very high turnover of the skin cells, and this results in the lesions that you see, which are often reddy pink, slightly raised patches with a silvery scale on top. When it's severe, it can be very widespread, but in the milder forms, it often just affects the elbows, the knees, the belly button, and the scalp's another very common site that can be affected. Is psoriasis contagious? The answer is definitely no. Psoriasis is not contagious, and you cannot catch psoriasis by touching the skin of someone who has psoriasis. The cause of psoriasis is not exactly known, but there are definitely genetic factors and there are environmental factors. As far as genetic factors, it's known that patients with psoriasis have an overactive immune system, and this overactive immune system causes inflammation in the skin and in other organs. Psoriasis tends to run in families, so if you've got a family member, particularly a first-degree relative with psoriasis, you're more likely to have it. Can psoriasis be triggered? Yes, psoriasis can be triggered by certain medications. It can be triggered when you're unwell or you have an infection, and there are certain environmental factors that can also trigger psoriasis, like stress. What treatments are available for the management of psoriasis? Well, the good news is that over the last 5 to 10 years, there's been huge advancements in the way we manage psoriasis. I would say that there are more drugs developed for the treatment of psoriasis than any other dermatological condition. Treatments are very effective, and if you only have small amounts of psoriasis, often the creams, the lotions, the potions can be very helpful to manage this long term. If your psoriasis doesn't respond to creams, there are other treatment modalities to consider. Next line would be something called phototherapy. This is where we treat the body with ultraviolet radiation, specifically something called narrowband UVB. So patients would go into cabinets. They usually come and visit the hospital 2 or 3 times a week and go into the cabinet for maybe only seconds or minutes at a time. And this would be treatment that would go on for about 8 to 10 weeks. Phototherapy is very effective for psoriasis, and it's a very safe treatment. So this is usually second line. If phototherapy is not effective, or if your psoriasis bounces back very quickly after a course of phototherapy, we do also have some newer oral medications and even injectables for the management of psoriasis. So if you are a patient with psoriasis and wish to have some further input on how to manage your condition, then make an appointment and come and see a dermatologist at Welbeck.